Hi, good morning, Dr. Rob Kiltz. How you doing today? I want to talk a little about abdominal pelvic inflammation and why laparoscopy, hysteroscopy may be important in evaluating and treating your infertility. None of us want to have a surgical procedure, but when conception is not happening naturally and or miscarriages, one of the causes is likely intra-abdominal pelvic inflammation. So that means there's inflammation in the tubes, in the uterus, in and around the ovaries, and most of it is coming from the abdominal pelvic environment. I believe it's mostly a gut environment, but remember that the cervix is open through the vagina and the fallopian tubes, so that makes it easy for bacteria and other bugs to get into the intra-abdominal space. But I believe the majority of them are coming from the gastrointestinal tract and are seeping into the intra-abdominal space that way. A laparoscopy is a surgical procedure where simply through the belly button you can place a scope called a laparoscope in a minimally invasive procedure that you can then view and look directly at the pelvis, the ovaries, tubes, and the uterus, and look for mild scar tissue that may not be picked up on a hysterosalpingogram, and it may not be picked up by symptoms such as pain or discomfort, but is a silent cause of infertility, which is the symptom is infertility in itself, that is showing its eyes in the sense of endometriosis, which is inflammation in the intra-abdominal space caused by, we believe, glands that come from the endometrial cavity. Yet my bet is it's simply an inflammatory reaction anywhere in the body, but most commonly around the ovaries, tubes, and uterus, and also behind the cervix and the uterus and the uterosacral ligaments. And this inflammatory areas can be either excised or vaporized in order to remove these inflammatory areas, which may be seeding the pelvis with other inflammatory cells which are related to the white blood cells and the reactions in the body to protect us, which may ultimately damage the sperm, the egg, and the embryo. What's supposed to happen every month is an egg is supposed to come out of the ovary, be picked up by the fallopian tube, and it's supposed to be fertilized by a sperm in the tube, and then this dividing embryo is supposed to travel and implant. But because of the excessive inflammatory environment, due to either something gets in through the cervix from the vagina, or systemically or intra-abdominally, it's going to affect these areas. And by simply looking in through a laparoscope or a hysteroscope, where we can directly look into the cervix and into the uterine cavity and look for evidence of small polyps or fibroids or adhesions, which may also adversely affect the sperm, the egg, the embryo attempting to implant. But once they've implanted, this excessive inflammation may ultimately affect the blood flow and or directly damage the embryo, egg, or sperm and prevent them from getting together or implanting. A simple scratch procedure or a D&C, where at the time of a hysteroscopy you can clean out the uterus. This may be essentially removing some of the damaged tissue, which allows fresh blood flow, fresh tissue to come in, which also may help enhance implantation. We've heard about the scratch procedure, and there's evidence that by simply cleaning out the uterus or doing a scratch procedure, you can increase implantation. Most of these are simple procedures under light sedation. General anesthesia we do typically for a laparoscopy. It's about a half an hour procedure. And if you look at the abdominal wall, it's usually an incision at the belly button and 1, 2, and maybe 3 5mm or 3mm incisions. They're very tiny, which allow us to not only look inside, but also manipulate and remove scar tissue, remove endometriosis, or simply identify that things are normal, allowing you to more appropriately move on to the next step, which may be insemination, or in many cases it may be in vitro fertilization. I believe a laparoscopy hysteroscopy should be incorporated early on in the process because quite commonly it can help a woman conceive naturally, but it also can help identify if there's significant scar tissue or endometriosis. It may be more reasonable to move on to IVF sooner. So it can be brought up at any time in the process, even after failed IUIs or failed IVF or failed implantation from even donor eggs. A laparoscopy hysteroscopy looking for endometriosis, I think, can be done at any point and should be brought up now. Why wait? Bring it up, ask the question, have the discussion. Would it be valuable for me? Inflammation is ultimately the culprit in this whole process that affects our fertility, our health and wellness. It likely is the cause of every disease we know. Where does it get into us? How does it happen? Where our body is reacting to foreign molecules. One of the most important things that we've been talking about is how eliminating variety of foods, getting rid of more and more carbohydrates, focusing on healthy fats, more fat in your diet, less protein, and certainly less, if not to move towards no carbohydrates. There's a lot of really good information out there. Marie Emmerich is one person that I've really focused on, but I like to keep it very simple. Bacon, eggs, butter, beef, baby diet. And so give it a change, give it a do. I always say, do or do not, there be no try. Master Yoda gave us that information, something really interesting to focus on. So health and wellness, food first. If those things aren't working, it's not happening naturally, then that's the time to look at more invasive procedures for further evaluation and treatment to help you towards your success. I've seen so many couples, individuals conceive by simply doing a laparoscopy hysteroscopy, even in the face of only a small amount of endometriosis or scar tissue. So removing these things increases your success rates, and it's something I think you should talk to your OBGYN or give us a call at CNY Fertility, and we'd be glad to assist you in this process. I hope I've helped in giving you some good information today. Have an awesome day. Dr. Rob Kiltz, CNY Fertility Centers.